And if you have a model, you're more than welcome to follow along with the numbers. I will explain if you any alterations with numbers. Okay. Any questions before we start? Good, we went over this already? Okay. Blood comes into the heart, into the right atrium, from three places: from the upper body through the superior vena cava, number 16, from the lower body through the inferior vena cava, number 26, and from the opening of the coronary sinus, number 58, from coronary circulation. Now, on the superior vena cava, we have three additional branches. We have 17 and 18, which are the right and left brachiocephalic veins. Brachiocephalic means these come from vessels that are located on the arms, brachio, and head, cephalic. On the posterior, we have the structure number 59. This is the azygos vein. Azygos vein. This you probably won't be asked on the model here, but it's good to learn because, again, when we go over to the vessels, which we will soon, this is one of the harder vessels to learn. So it's good to have a place where we end up. Now, all those places will lead into the superior vena cava. We also have the inferior vena cava 26 and the opening of the coronary sinus 58, and all those lead into the right atrium. This flap on top of the atria, this is called the auricle. We have a right auricle, number 2, and a left auricle, number 51 on the left atrium. Entering the right atrium, we have deoxygenated blood, which gets pushed into the right ventricle. Now, the muscle on the atrial wall here, number 52, is called the pectinate muscle. Pectinate muscle contracts so it can push blood through the tricuspid valve, number 35, into the right ventricle. We have three types of muscle we're going to learn. The first one is the pectinate muscle in the wall of the atria here. The second one is the trabecular carne. Trabecular carne is the muscle of the ventricles. Trabecula refers to the spongy shape or the structure of the muscle itself. Carne refers to the actual meat of the muscle, the muscle itself, right? So pectinate muscle will push blood through the tricuspid valve into the right ventricle where we have our trabecular carne muscle. Now, the third muscle we're going to learn are these little muscles on the cusps of the tricuspid and the little red end here, the bicuspid valve. These are called the papillary muscles. Good? Tricuspid valve will have 3 papillary muscles. The bicuspid valve will have 2. Now, if you're following with an answer key, it's probably because you have a lazy professor that didn't really give you their own stuff to study. So you're going to be studying from an answer key, and you have to be careful because with the answer key, it just goes by numbers. It doesn't really go by structures. If you take a look at the papillary muscles on the tricuspid valve, one of them is number 40, one is number 42, and one is number 62. They're different numbers because they're showing different things. 40 is supposed to be showing where the papillary muscle attaches to these little strings called the chordae tendineae. These little strings help to open and close the tricuspid and bicuspid valves. 42 is showing the muscle structure itself of the papillary muscle, and 62 is showing where the papillary muscle attaches to the trabecular carne. So 62 would be trabecular carne. On the exam, they don't care about numbers. They will put a marker here, and it doesn't matter what number it says, the answer is papillary muscle. 62, 40, or 42, so you have to be careful. Right there. Number doesn't matter. 62, if you have an answer key, 62 says trabecular carne.
Yes.
Yeah, that's not trabecular carne down here. Trabecular carne is out here. No, papillary. Papillary, yes. So you have to be careful with that, right? That's why if you get an answer key, make sure you know. They're not going to show you, they're not going to be like, what's number 62? They will put a sticker right here, and they will ask you, what is this muscle? And if you were trabecular carne, wrong, 0. Done, failed, right?
So
No, you'll be fine.
what should put for 62?
No, nothing. You just look at the muscle. If they put it here, papillary. They put it here, trabecular carne. They put it here, trabecular carne. They put it here, papillary. If they put a piece of tape around, they usually put a piece of tape around or rubber band around the cords like that. That is the chordae tendineae. So just be careful with those numbers. Okay? Questions? Let's go over that again real quick. Blood in the right atrium is pushed by pectinate muscle through the tricuspid valve, which is held down to the trabecular carne of the right ventricle by way of papillary muscle attached to chordae tendineae on the cusp of the tricuspid valve. Easy, right? Good. Blood passes from the right ventricle through the pulmonary semilunar valves, up the pulmonary trunk, and out the right 9A and left 9B pulmonary arteries. Blue vessels, because blood has no oxygen. Arteries, because they're leading away from the heart to go to the lungs. The right one exits out this way. Now, we'll take a break from our pulmonary circulation. We'll go to this structure up here, number 10. Number 10 is a structure called the ligamentum arteriosum. This is an important structure. The function of it is holding the pulmonary trunk to the aorta, because when you have blood flow, you'll see a lot of movement. Blood has to go out all these different ways all at once, so there's a lot of movement in the aorta. So to hold it down, to ground it, keep it from flying off, you have this little ligamentum arteriosum. The secondary function in a fetal heart and fetal circulation, this is a vessel that allows for blood to pass directly from the pulmonary trunk to the aorta, aortic arch. Why? Because a fetus can't breathe with its own lungs in the mother's womb, so it collects oxygen from the placenta. For that reason, a lot of the blood bypasses that pulmonary circuit and instead goes directly into the aorta. That duct in the fetal circulation is called the ductus arteriosus. The way they ask that, they put a marker here. They ask you, what is the structure called? Ligamentum arteriosum. Or they ask you, what is the structure called in fetal circulation? Ductus arteriosus. The second structure or second marking you have to know for fetal circulation. Number 55. 55 is an indentation or a little discoloration inside the right atrium. This is called the fossa ovalis. In a fetal heart, this is an opening, and the opening allows for blood to pass directly from the right to left atrium. We'll go over fetal circulation later, but that opening is called the foramen ovale. And they'll ask it the same way. They'll ask you, what is the structure called, or what is the structure called in a fetal heart or through fetal circulation? Questions with that? Good. Blood goes to the lungs, collects oxygen. Blood gets sent back from the lungs through two sets, the right and left pulmonary veins. Veins drain into the heart. So those are taking oxygen and blood. They're red because they're taking oxygen and blood. They're veins because they're draining into the heart. And that leads into the left atrium. How's it going? The left atrium sends blood, oxygen and blood, through the bicuspid valve, which is held onto the trabecular carnate of the left ventricle by way of papillary muscle attached to coronary tendon on the cusp of the bicuspid and mitral valve. You know that already. Blood passes from the left ventricle through the aortic semilunar valve, 45, up the ascending aorta, across the aortic arch, number 12, and down the descending aorta, number 19. On the aortic arch, we have three vessels to go to upper body circulation. Number 13, the brachiocephalic trunk. Number 14, the left common carotid. And 15, the left subclavian. Subclavian means underneath the clavicle. So the left subclavian goes out underneath the left clavicle out to the arm. Common carotid means carotid canal in the skull. So this one will come up the left side of the head. If you feel your pulse on the left side, that's where you could feel that. Brachiocephalic, brachio, arm, cephalic, head. So this is going to split into two vessels. One that goes up to the head and one that goes out to the arm, like that. And those two are the same as these two, but on the right side. This will split into the right subclavian and the right common carotid. Does that make sense? Questions with that? Okay, that you can't see on this model. That's the first thing we're going to look at when we go to the vessels. So that's, you might as well try to remember that now.
Can you just go over this part, like the brachiocephalic and then
Brachiocephalic trunk, left common carotid, left subclavian.
Yeah.
Brachiocephalic trunk comes up, it splits into the right-sided versions of these two, the right common carotid and the right subclavian.
Oh, okay.
Does that make sense?
Yeah.
So what you'll see on the vessel model, it'll literally look like that. Like there'll be like a little vessel right here, and then it'll split. Okay, and they like to ask that little bottom portion of the vessel because you have to know that's not the common carotid or the subclavian. That's the brachiocephalic trunk. Any questions with all that? That's everything for the exterior of the heart model.